freehelpforcancer.com. I wanted to talk to you about pain management. I see two ends of the spectrum when I look at my friends and people that I know going through treatment. You have the extreme end where the person expects to not go through any pain at all, which is I think is ridiculous. And they take drugs instantly whenever they can. And then you have other people that want to avoid drugs at all costs, and they don't take drugs when they should, when they're desperately needed. So I wanted to go over how you can find a middle ground that works. First thing I want to show you is when Kayla was on a lot of drugs, and she was on a lot of drugs. She was on usually 8 different chemos for 8 weeks, and then she was also on pain medications. So I marked the bottles extra, because if you have 10 bottles that look like this, they all look the same, and I was deathly afraid of mixing or making mistakes. So although the handwriting is terrible, I'm going to show you this close up. This is long-acting morphine, and you see I put M's on the top and I wrote on both sides morphine so that I would know. What we did is we asked for the painkillers in a liquid. Let's say the doctor said give her 5 ml. Well, 5 ml is this whole tube, right? What I would do is I would give her 1 ml, which is this much, and I would see how she did. If it worked to get rid of the pain, then I kept her at that dose. If she still needed more, the other thing I would do is I always kept paper and pen, and I would note down the time and the amount I gave her the drug. This is very important. So if she needed more, then I'd give her more. Then I'd know we were up to 2 doses, still all within, let's say, 4 hours. Your body will build up a tolerance to drugs. That's the unfortunate fact. So I always hated starting at the highest amount, knowing that if she was in the pain she was in for a long period of time, the drug would start to not work. This is very important information for you, because people in long-term treatment, any kind of treatment, where they are on pain medications, the body will build up a tolerance. So we always tried to go with a liquid form. You see I got my little handwriting on it. This is liquid morphine. What we eventually had to do is Kayla was put on 12-hour time-release morphine, 1 in the morning and 1 in the evening, and then she would get liquid morphine in between for what is called breakthrough pain. Pain management is so important for quality of life of patients, because when you're in severe pain, you can't do anything. You can't enjoy anything. There's no pleasure. So that's where the juggling act comes in, figuring out what's the right dose, how often to schedule it. And I did try and stay within the doctor guidelines of, if the prescription said 4 hours, I'd try and go 5. And each person is different. So breakthrough pain, what the doctors explain to us, is once the pain escalates and gets out of control, then it's much harder to bring it down. Okay, so the key points are: label your bottles, keep a notepad or a clipped chart, something, and keep it in the same place so that you can keep track of how much the patient has taken or you're taking yourself, so that you don't over-medicate. The other thing is that there are alternatives to help with pain. Kayla went through severe bone pain. I made a paste of, I took cream, crushed up vitamin C into a fine powder, and it was a lot, and I put it in the cream, and I would put a plastic bag under the recliner where her feet was going to be, put her feet there, slathered them up, put another plastic bag over her feet, and then put a heating pad on it. And although she said it did nothing, she stopped moaning. She was literally sitting there watching TV and moaning in pain. And I couldn't give her any more morphine. So there are things that you can do: hot compresses, cold compresses, changing position, using pillows, entertainment. These are the things that you can do to help the patient get through the episode, and that's what you want to do. And quality of life, to me, is the #1 issue. So those are the tips I have for pain management. I hope these help you, and there's more information about this on my website. Thank you very much.